Good morning, everybody. It's been I don't know, a few weeks since I've uploaded anything to the YouTube channel. I wanted to give you a little bit of a rundown of what's been going on the last few weeks, maybe, and talk about what happened yesterday. I'm in Anaheim, California right now. Just woke up early. I'm still on Missouri time, you know, a couple hours ahead of California time. But I had an opportunity to spend basically the whole day with Dr. Zach at West Covina Dental Group in California, there in West Covina. It was really eye-opening. You know, Dr. Zach is running a very busy dental office. He has basically 3 full-time GP associates, a full load of specialty, and a very high-functioning dental office. So, quick shout out to Dr. Zach. Thanks so much for letting us spend the entire day disrupting your dental office. But it was a great opportunity to learn from the master, truly. So let me give you a few thoughts about that, and then I'll kind of go back and talk about everything else in my life for the last few weeks. So, you know, one of the challenges that we have in a dental office, of course, is establishing and setting up protocols and systems that allow us to be highly effective and very productive. You know, we struggle, many of us, maybe I'm speaking just for myself, struggle with the desire to help people, balancing that with, you know, charging people money. And so for some of us, well, probably for all of us, it can be difficult to say, you have this concern, you're gonna need to pay me this amount of dollars to fix that, right? So that creates a challenge for us sometimes. So it's helpful to establish some structure around what we're treatment planning and why, so that we no longer have to revisit why we're treatment planning these things. And then the protocols and processes in place from the treatment plan going forward. So for instance, when a new patient comes into the office, once we've established a good rapport and made a great connection with this patient, helping them to know, here are the problems that we've identified. Here's what the consequence of those problems are. And then with the patient's input, discuss the treatment recommendations for each problem and come up with a game plan, a treatment plan, a list to move forward with. Beyond that, you know, all the question marks about dollar signs and money should be handed off to the individuals that are actually capable of having that conversation. If any of you know me, you know for sure that I don't know anything about the insurance side of dentistry. And anytime I try to start talking about it, I get myself in trouble. And I'll either underestimate or overestimate, or I don't know. I just make a lot of mistakes, so I try to stay out of that conversation. But all that being said, once we've got the protocol in place, like I said, to diagnose appropriately and consistently, and then work through the systems of insurance and the patient getting the estimate that they need, then we should be able to do a lot of dentistry and to start and complete a lot of dentistry on the same appointment. So, you know, one thing to consider along those lines of starting same-day dentistry is we need to make sure that our team, and again, I'm learning this from Dr. Zach as well, he's reinforcing it very, very well with his team. The purpose of the patient coming into the office today is to get dentistry done today. We want to try to do as much dentistry today as we possibly, as a team, can get done without disrupting everybody else's, all the other patients' schedules. But I think you'll find, and I definitely saw this from Dr. Zach and his team at West Covina Dental Group, that the way that they execute dentistry is consistent and it's very efficient. You know, the processes, like I said, the processes they have in place are very, very good. You know, CEREC is definitely a big part of the equation. But if a patient needs a restoration, the BC is done immediately. The BC handoff is a non-negotiable item for the team at West Covina. Once the BC is done, the patient, assuming the patient wants to start, the treatment started and things move forward, and it moves forward very efficiently. One of the things Dr. Zach was very specific on digging into was making sure that his associates follow the same protocols that he does with regard to treatment order. So that all the assistants know exactly what's going to happen next. They use the same materials, they use the same cements, the same, you know, techniques, the same burrs. So the assistants never have to wonder, what do I do next? Now, occasionally something will deviate, of course, but generally, the vast majority of cases, they're all identical from the standpoint of the process and the procedure. So, you know, to kind of go back and distill, and I've got pages and pages of notes I was typing in on my phone the whole day, and I'll certainly be sharing that with you here as I am able to identify those gems that are helpful. But to distill it all, really it's all about processes and it's about execution. You know, the PPE process, the perfect patient experience process, has been established and defined and clearly tested. We know that it works. The challenge that we have is executing it over and over and over to a high level. And for me, as I mentioned at the beginning of this video, for me, one of the challenges that I have is sometimes my heart gets in the way of, as I think about how much this treatment could cost the patient, sometimes my heart gets in the way and I have to make sure that I adjust my mentality so that I can acknowledge that the treatment I'm recommending is actually in the patient's best interest, regardless of the price. So we have to separate the price from the procedure that's necessary. So, you know, it's been a great opportunity. Like I said, we're going to spend some time today in a couple other offices. I'll give you a little bit of a report there and give some feedback about what's going on. You know, we in my office in O'Fallon are getting ready to transition to Epic, the new dental medical management software. Pretty excited about that. It's going to give us a lot of functionality that we didn't have with other software versions. Mostly will be the integration of the medical side of the puzzle and also the patient's ability to see how, in an easier way, to see how their dentistry, their dental care, their especially oral, periodontal care can impact and will impact and has an impact with their medical needs, you know, diabetes, heart attack, stroke risk, Alzheimer's, all these things. So we're looking forward to that. You know, I have two associates right now at O'Fallon, and they're both doing great. You know, we have been pretty intentional, at least I've done my best to be intentional about the coaching and mentoring and teaching piece of the puzzle. But I see now from my visit yesterday and probably will from the visits today that it needs to be very deliberate and very intentional. Game plan, lesson plan, you know, creating these opportunities for our associates to learn and to grow. So I had a doc ask me the other day what the next 5 or 10 years of dentistry looked like, or what I thought it would look like, you know, with medical and dental integration and, you know, big DSOs and corporate dentistry coming into the picture. You know, and I've had a chance to think about that a little bit over the last few weeks. And I think we've got a lot of great things heading our way. One of the challenges we'll need to resist, though, is, you know, and this goes without saying, but I'm going to say it anyway. One of the things we need to resist is the desire to focus too much on dollar signs as a source of income, but rather focus on those dollar signs as an indicator of how many patients and how much treatment we've been able to provide. If any of you have worked with me for any length of time, you'll know that, you know, it's really important that we manage each penny that comes into the practice, of course, with regard to how much we're spending, what we're buying, et cetera, et cetera. But it's also absolutely critical that we're cautious with regard to how we visualize that, what that money represents. Really, honestly, it should represent a patient served, a procedure offered, the ability to improve a patient's whole body health. It's really absolutely critical that we ensure that our mentality is focused around service to individuals. And as our heart's in the right place, as our mentality's in the right place, we have the systems and structures in place, things will move forward such that we can execute dentistry repeatedly and consistently is the word I'm looking for, in a way that not only grows our practices and our patient base, creates lots of patients for life, but allows us to improve our associates' well-being, and gets us and our associates and our team and our patients' lives to be better. So thanks for watching a short 10 or so minute video. Appreciate your feedback and input. I'll give you some more details and nuggets of knowledge here once I'm done with the visits today. Over the next few days, we'll hopefully put those online. So thanks for watching. Have a great day.